Dr. Griffin P. Rodgers has dedicated his career to eliminating racially based health disparities. The physician investigator developed the first FDA-approved treatment for sickle cell disease, and today leads the National Institute of Diabetes and Digestive and Kidney Diseases. As director, he oversees medical research, training, and educational initiatives aimed at preventing and alleviating chronic diseases, many of which disproportionately affect minorities. He has also established several programs focused on diversifying the biomedical workforce.
Well, it's critical that we pursue a path to health equity because all Americans deserve to have a healthy and long life. When we take the oath, the Hippocratic oath as physicians, we really have a moral obligation to become healers. The social determinants of health are so important that we have to really address this in a holistic manner. Our institute is working on not only the genetic basis of these diseases, because we know in most instances genes are involved, but it's not just the genes. As we move forward, sort of integrating our knowledge of genomics and social determinants of health, we really do have to continue to focus on this. We have to do better, and I challenge all of my colleagues and challenge myself to redouble our efforts to use the data that we're accumulating and turning that data into knowledge, and then ultimately turning that knowledge into action. Diversifying the health workforce is extremely important in our view. One of the things that I'm most proud of is that our studies, our large clinical studies and our clinical trials, because many of the conditions that we were responsible for disproportionately affect underrepresented groups, we want to make sure that we not only recruit patients in these trials, but we retain them so that by the end of the trial, we can make sure that the results can be extrapolated to the populations at greatest risk. Well, there are many people to thank for the awards. Obviously, my parents and my wife and my sons who've sort of put up with my antics all these years. And clearly, I want to give my deep thanks and appreciations to the many patients that participate in these trials, ultimately making the lives of future generations better. And more proximately, obviously, I want to thank the awards committee for having nominated me and suggesting that I receive this award. This is really a tremendous award. I knew Dr. Herbert Nickens personally. Our children went to school together, and I'm very delighted to be honored in this manner.